Welcome to this video tutorial of pharmacology. In today's session, we are going to do the introduction to pharmacology. Okay, so pharmacology is the study of drugs and their action on living organisms. So this is basically the definition of pharmacology. So it's just the study of drugs and their action on the living organisms. So therefore, a sound knowledge of basic pharmacology principle is essential for a nurse to safely administer medication and to monitor patients who receive this medication. The administration of a drug is fundamental responsibility of a nurse. So having a sound knowledge about pharmacology of a drug to a nurse is actually important for them to administer the medication safely, and apart from that, also to monitor kind of side effects, the reaction that we don't expect but they emerge in the process due to a number of physiological reasons. Okay, so understanding this or having sound knowledge about pharmacology, make sure that the nurse performs the task safely and accurately to avoid the mistakes. Okay, so in addition to this, it's very much important that as the nurses administer this medication, they monitor what we call the therapeutic response and they report the adverse effect reactions. So the therapeutic response is to determine whether the medication that you've been given has performed the intended function. Or apart from that, like I said, sometimes you can give drug and they are going to give other reactions, which we call adverse reactions, things that you didn't expect to occur, but they happened anyway. Okay, so apart from that, it is also important for nurses because the nurses are responsible for what? Teaching the patient and the family members necessary information about this, specifically drug administration. Okay, because you need, especially in the discharge plan, you explain how to administer that particular drug, the frequency, etc. Okay, so now what is the general objective for this session? So the general objective for this session is that at the end of this lecture, students should acquire knowledge on the origins of pharmacology together with its basic principles. Okay, so on the origins of pharmacology, we have described what pharmacology is, and we are going to look at an overview of the history of pharmacology. Then from the history of pharmacology, we are also going to look at the basic principles of pharmacology, which are two principles of pharmacology. We have major two, which is pharmacokinetics and pharmacodynamics. This video solely want to explain to you what is pharmacokinetics and what is the pharmacodynamics. Then our specific objective is to define pharmacology and briefly state its history. Looking at the history of pharmacology, how did our pharmacology come into sound? Then we're going to explain different terminologies and abbreviations used in pharmacology. So there are a lot of terminologies and abbreviations that are used in what? Pharmacology. So we're going to look into those. Explain the responsibility of a nurse in drug administration. So apart from that, we're also going to look at the responsibilities of a nurse in drug administration. Then outline the principles of clinical pharmacology. So we're also going to look at to outline the principles of pharmacology. So this session mostly is going to focus on the principles of clinical pharmacology, because this is where the basis for pharmacology is. So now, the word pharmacology is derived from a Greek word, pharmakos. Okay, this pharmakos is a Greek word which means medicine or a drug, and logos, which means study. Okay, So it is a broad science that includes all aspects of the subject of chemical substance that act upon body cells. Okay. So pharmacology studies the effect of a drug effect, and how they exert their effect on the body. So drug effect and how exactly, this is the mechanism. What is the effect of this drug? So for example, if we look at the drug like paracetamol, which is also known as Panadol. So what is the effect of Panadol? It actually helps in relieving pain. And now we are looking at how exactly does it affect that effect of relieving pain. Okay. Then practically the study of drugs and how they act. So we are going basically pharmacology is just to is the study of drugs and how they act. So looking at the drugs and how they act, that's pharmacology. So how did pharmacology come into sound? The birth date of pharmacology is not as clear cut. It's not really known. As early as 19th century or even before, the Egyptian, Arab, and the Latin knew how to use medicines through, though they were totally ignorant about pharmacology. So this information is explaining to say that pharmacology existed in as early as the 19th century. Okay, people used to use medication drugs, but they never had much evidence about how these drugs used to work. Okay, how how these drugs, like the side effects of these drugs, no one has got sound knowledge about this. So the Egyptians used the senna for the treatment of constipation. So Egyptians used to use senna for the treatment of constipation. Senna is one of the medication that is used to treat constipation. And the Arabs used opium for the treatment of minor disorders. Opium is a drug. It's obtained from the plants. Okay. However, both did not understand the effect of drugs until much later. So you find that a pharmacology, just to summarize the history of pharmacology, pharmacology existed, but people were ignorant. I mean, drug existed. I Pharmacology existed, but people had no sound knowledge about it, the mechanism of action, how that drug works. They just used to treat medication, treat conditions using try and error. Okay. However, synthetic chemistry or organic chemistry was born in 1822. I mean 28. This is now uh, scientists were trying to understand the chemical structure of drugs, like so that they can use to synthesize the drugs. Okay, so all this in a nutshell. Um, there's finally now who there was this scientist known as the Oswald Chesterberg. So Oswald Chesterberg is the generally considered to be the founder of modern pharmacology, because he made most of the investigations, tried to understand pharmacology in a more deeper perspective, trying to understand the side effect of a drug, mechanism of action, etc., etc. Okay, so that's it about the history of pharmacology. In a nutshell, it existed. People used to use trees in curing condition, diseases, among others, but they never knew the specific how those drugs actually worked. Okay, now let's look at different terminologies used in pharmacology. What is a drug and what is medicine? So I'm going to differentiate drug and medicine in a simpler way. Okay, so a drug produces biological effect. Biological effect is any effect that a substance can induce in the human body. Okay, so biological effect is looking at the overall general effect that a human can manifest with. However, when it comes to medicine mainly it solely depend on producing the therapeutic effect. It is just for healing purposes. Okay, so we can say that all medications, okay, we can say that in conclusion of the difference between drug and medicine, we can say that all medicine are drugs. I mean, all drugs are medicine. Okay, all drugs are medicine, but not all medicine are drugs. Not that way. All drugs are medicine, but not all drugs are medicine. Okay, all drugs are medicine, but not all medicines are drugs. So what I'm saying to say is drugs, medicine is under drug. Okay, medicine is under drug, but it's not every drug that is there for therapeutic or intended. So drug is a broad term, then medicine falls under drug because it's there. The therapeutic effect is under the biological effect. Okay. So what is the half-life? Half-life, it just refers to the time required for the body to eliminate 50% of the drug. That's the half-life. You find some terms like pharmacotherapeutics is just the use of drug in prevention and cure of diseases. Then we have pharmacoepidemiology, which is the study of effects of drugs on the population. Then we have pharmacoeconomics, which is the study of cost effectiveness of drug treatment, cost effectiveness of a drug treatment, finding the best treatment, yet looking at the costs of that particular drug. Pharmacognos, this just the study related to identification of plant drugs. So pharmacognos is about studying the plant drug. Then the toxicology is just the science of poison, which includes detection and measurement of poison as well as treatment of poisoning. So in as much as these drugs are intended for therapeutic effect, but too much, maybe administering overdose can lead to toxicity. Okay, so that's why it's important that you study toxicology. So it's just the science of poison, which includes detection and measurement of poison as well as the treatment of poisoning. Drug interactions. So the drug interaction is about when one drug administered in combination with or shortly after another drug alters the effect of one or both drugs. This is known as drug interaction. So there are some drugs which when once administered together, they alter the effect of each other. They can either increase the if they can actually increase the effect or reduce the effect of that particular drug. We have examples here. We have the one which is inducer and inhibitor. We have rifampicin and oral contraceptives. So in case of rifampicin, someone who is on TB treatment and then um, they want to take oral contraceptives. Okay, oral contraceptive. So rifampicin is an inducer. These oral contraceptives, they are measures that the couple try to reduce. They try to prevent pregnancy. Now the thing is, if someone is on TB treatment and they're taking rifampicin and then they engage themselves in a sexual intercourse with a man and then they want to take oral contraceptives to prevent that pregnancy, that the rifampicin is going to accelerate the metabolism, the breakdown of this drug, so that it doesn't stay long in the system and it can be what excreted. Okay, then it has induced the effect, meaning that these oral contraceptives should not be given to someone who is on rifampicin treatment because they won't work. Okay, then we have another example where we have grapefruit juice. So when someone who is on nifedipine is a medication which treats hypertension. Okay, so what happens is that in as much as someone is having hypertension, nifedipine reduces BP to a pressure that is normal. and that can sustain a human cardiovascular system. Now, the problem is when you give nifedipine and grapefruit juice together, what grapefruit juice does is it acts as an inhibitor. It reduces the metabolism of nifedipine, meaning that the breakdown is and the distribution is going to be what? To be lowered. Once it is lowered, meaning that nifedipine will take long time in the system. And if it takes long time in the system, what will happen is that nifedipine will have a longer effect. It's going to severely reduce the blood pressure, and the patient will go in the hypotension. So you see the effect. That's what drug interaction means. So as a nurse, as any other health practitioner, you should have sound knowledge about drug interaction so that you rule out some drugs in taking with others, and then you also enhance the drug or the effect of another drug by administering another drug. Okay. So there's what we call dispensing. What is dispensing? So dispensing refers to the preparation, packaging, labeling, record keeping, and transfers of prescription drug to a patient or an immediate intermediary who is responsible for administration of a drug. So as a nurse, dispensing occurs during the discharge. Okay, when this patient was under care, but it's time now for them to depart, for them to go home, and we want to explain, to give information to this patient so that safe and accurate administration continues. So that's basically dispensing. So some of the examples of dispensing include when the client is leaving the facility, but they want to continue the medication while away. Okay, so this entails that a nurse, you are bound by the law to give patient the right drug for the patient's presenting condition. Okay, and then dispensing is when a client is given medication for administration at a later time, like when you just give a client so that they can take, maybe this person comes into the hospital, and then this particular medication they want to take is that they need to eat before taking that particular medication. Okay, so what do? You tell them to say that you are going to take this medication at home and give information. That's dispensing. So what are some of the principles of dispensing? The principles of dispensing, more like they are just rules that attach to when you are dispensing medication. So we have dispense medication when it is in the best interest of the client. Okay, dispense medication only to clients under your care. When taking steps to ensure pharmaceutical and the therapeutic stability, always review the order for completeness and the appropriateness. So make sure that safely it actually does not affect the client. Make sure that you review the order, the prescription for the dose, route of admission and frequency, and the drug itself, so that you don't harm the patient. So these are some of the principles. And the other ones is review the client's medication history and other personal health information. Okay. Apart from that, you need to consider potential drug interactions, contraindications, meaning when is a drug not given. Okay, and then allergies, when you're giving this drug, maybe some people are allergic to some kind of drug like penicillin, therapeutic duplications, and any other potential problem like side effect. You need to make sure that you look into all these matters. Then consider the client's ability to follow the medication regimen. So when you're dispensing medication, you don't just dispense anyhow. You can't dispense medication to someone who is 6 years, to a child who is 6 years. They are more likely to forget. So that's why consider the client's ability to follow the medication regimen. And apart from that, also look at those people who are mentally disturbed. You can't dispense medication to them unless someone is there who can keep the information. Okay. So now, as I mentioned, in this session, we are going to concentrate on mostly two principles of pharmacodiagnostics. pharmacology. So the principles of pharmacology builds the foundation for most of the pharmacological discussions that are going to be undertaken. So if someone doesn't understand the principles of clinical pharmacology, then you are more likely to have problems throughout the course of pharmacology. So we have major principles, two major principles of clinical pharmacology, and that is pharmacokinetics and pharmacodynamics. We are going to describe them in detail now. Make sure that you pay attention and make sure that when you don't understand, comment in the section so that you I know the areas of improvement, or you can actually um, go to my bio description box where I usually leave the number for WhatsApp, and make sure that you text me so that I discuss in case of any queries that you might have. So now let's start with um, pharmacokinetics, and then we'll go to pharmacodynamics. We want to understand them so well. This is the basis for clinical pharmacology. Understanding this will help you throughout the course of pharmacology, and you need to make sure that in case you have issues with understanding physiology, you review the physiology, and now you're going to understand this better more. Okay, so now what is pharmacokinetics? Pharmacokinetics is a principle of clinical pharmacology that describes about how a drug is from the time when you take medication. Okay, from the time when you take this medication, maybe it could be orally, let's say Panadol, you take it oral, then you even swallow it with water, and then it goes into the body, then it starts moving. Then how is the body going to transform this medication? What is going to remain, and how is it going to move out of the body? That's a pharmacokinetics. Okay, so now the pharmacokinetics is the core concept in pharmacology, just like that, the way I mentioned. This is a core concept in pharmacology that deals with what the body does to a drug. Okay, so these two things, the pharmacokinetics and pharmacodynamics, they are the opposite of each other. So what the body does to a drug, we call it pharmacokinetics. But what a drug does to the body is what we call pharmacodynamics. So like I was mentioning, what happens is, what evidence are we going to have that pharmacokinetics is what the body does to a drug? When you take in the drug, it's going to undergo some kind of metabolism, okay? It's going to be broken down, it's going to be distributed, it's going to be absorbed. At that particular time, the drug is doing nothing to the body, because the drug is the one which is transforming this drug, okay? It's changing it, moving it until it reaches the area of what infection. That's why we call it what the body does to a drug. Now, in pharmacokinetics, before we go further, we need to look at various routes in which a drug is administered. Okay? In what ways is the drug administered to a patient? What routes, when you're going to give medication, what routes do you use? And this slide has all the routes of drug administration. Okay? All the routes of drug administration. Let's look at one by one. So in the routes of drug administration, we have two major categories. We have what we call local, meaning that you introduce it to a specific area, and then system, which meaning that it's going to enter the blood. Okay, it's going to enter the blood, the system. So now on the local, we have what we call topical. Topical, there's a medication which you can apply on the skin. Okay, there's a medication you can apply on the skin, topical. And then we also have intra-articular. So in the intra-articular, this is kind of medication that you just inject in the vein. Sorry, in the joint. Okay. So this kind of drug administration route you just introduce a drug into the joint. Okay, so it could be the synovial joint. Okay, then you just introduce this drug. And then we have what we call intrathecal. So this intrathecal medication, these are kind of this is a route where a drug is introduced direct into the spinal cord. So these are the local one, meaning that you are giving to a specific area, like you are inserting a specific area. And then we have the system. This drug goes direct into the blood. They are intended for them to go into the bloodstream, but not saying they go direct into the bloodstream. They can be administered in different areas, but their intended area is for them to go into the bloodstream. So we are under systemic, we have two major subcategories. We have the enteral and the parenteral. Now, the thing is, with enteral is just a Greek word which means the gastrointestinal tract. Okay, so the enteral meaning that it's going through the GIT. So what are some of the routes of drug which go into the GIT? We have oral. The drug that you take orally, they go into the GIT because it's taken more like food. So they need to go into the GIT, gastrointestinal tract. And then we have drugs like some drugs which are administered through the rectum. We call this route as rectal, and they also go into the GIT. Now, it's very much important. You'll see the effects of this drug administration as we describe the pharmacokinetics. Then we have what we call parenteral. Parenteral, okay? Usually, para means outside or around the circumference, okay? So, parenteral, meaning that we are talking about outside the GIT. So, these medications are given through the routes which are away from the GIT. What routes are these? Intravenous, just direct into a vein. Intramuscular, given into a muscle. Subcutaneous, just below the skin. Then we have transdermal, which are given just immediate, just below the dermis. Then we have nasal, which are actually applied in the nose. And then we have inhalations, which are just usually inhaled and then they work. And all these are parenteral, meaning that they are not using the GIT. But what is the fate of all this drug administration is that they will go into the what? Into the system, which is the blood system. However, all these routes, the drug is going to stay where you administer them. That's why they are calling them local. Okay. So on this one, maybe if I can help you have a major understanding on this, we have what we call local artists and international artists. Local artists are within the region, but international artists are those which crosses the countries. So local, they stay where you put them. Okay, meaning you introduce them to a specific area. Okay, now let's now try to describe pharmacokinetics. Pharmacokinetics is super simple. In pharmacokinetics, we have four major principles of pharmacokinetics. And once we describe these principles of pharmacokinetics, we can even go to now pharmacodynamics. This one is just an overview to the introduction. Okay, I'm going to explain more about each individual component of principle pharmacology by itself. But this one is an overview so that you know how these things work. So on the four principles of pharmacokinetics, remember we said what the body does to a drug. It's more like you take this food and then the body starts making transformation to this food. Okay? Digestion of carbohydrates, what for it to be absorbed, and that is what is going to happen to this drug. Hence, we call it what the body does to a drug. Okay? Because the drug can only act once it reaches the intracellular where it is intended, where there is an infection. Okay, so let's look at the principles of pharmacokinetics. We have absorption, distribution, metabolism, and elimination. Okay, these are the major principles of pharmacokinetics, and that if you know all of these, then you are good to go. So we have what we call ADME. ADME will help you remember the principles of pharmacokinetics. A is absorption, D is distribution, E is metabolism, E is elimination. Now let's discuss one by one what they mean. Super simple. What is absorption in pharmacokinetics? Remember I gave an example of it's more like you take food and then it starts moving. The way you learned the digestion of carbohydrate, where it goes in the mouth, then the esophagus, stomach, then until it reaches the small intestine and then it is absorbed, then it gives you energy. Now, it's different from the drug. That energy we're talking about is the therapeutic effect. It heals you. That's how it moves. Okay. So what is absorption? First, drug absorption from the site of administration permits entry of the therapeutic agent, either direct or indirect, into the plasma. So remember we described about different routes of drug administration. We look at the entero through the GIT and the parenteral away from the GIT. So whatever route that you are going to administer this drug, what is involved in absorption is for this drug to enter, okay, into the plasma from the site of administration. We just want this drug to enter into the plasma. That is what we call administration. I mean, absorption. Whatever route that you used to administer this drug and it finds itself in the plasma, then that's what we call absorption. Again, first, drug absorption from the site of administration permits entry of the therapeutic agent either direct or indirect into the plasma. The direct we are talking about is those measures where, like intravenous, the one which we are looking under parenteral, okay, which is systematic. So under systematic, we look at the enteral and the parenteral. So this intravenous was under the parenteral, away from the GIT. So the parenteral, like intravenous, it goes direct into a vein. That's why they have put whether direct or indirect. The indirect measures we have, let's say the rectal and the oral drugs goes indirectly. They need to be absorbed via the hepatic portal vein and then they go through the thoracic and then they go to the heart using the superior vena cava. Okay. But for this one, that is direct. So absorption is just looking at the drug for it to enter into the blood plasma, whether indirect or direct, from the area where you have administered this drug. How about distribution? Distribution is the second. The drug may then reversibly leave the bloodstream and distribute into the interstitial or intracellular fluids. So now, once this drug now is in the bloodstream, remember the intended area is not the bloodstream. It needs to go into the cells for it to have its effect. So once this drug now can leave the bloodstream and distribute into the interstitial or intracellular fluid where it goes. It moves from the bloodstream, it goes into the cells. We call that distribution. How about metabolism? The drug may be biotransformed by metabolism by the liver or other tissues. So metabolism is this drug being now transformed, whether if it was toxic, maybe it was not active. Let me use about active. Those drugs which are inactive, there are some drugs you administer which are not active. The liver is going to change it into active form. Those toxic drugs, then they want to be transformed into non-toxic drugs. We have also, apart from that, we can also have drugs which are fat soluble into a water soluble. Okay, because fat soluble drugs cannot be excreted out of the body. So it needs to be transformed into a water soluble so that it can move into the GI, which is the water environment. And then we have elimination. Now that the drug has been biotransformed by the liver, remember you should take note that the liver is the primary site for metabolism. It's the one which is usually involved in it, biotransformation of drugs. You should take note that is very much important in pharmacokinetics. Elimination. Finally, the drug and its metabolites are eliminated from the body in urine, bowel or feces. Now the drug now is going to leave the premises. It's going to leave the body and be expelled out. It could be through sweating, through urine, through bowel, or through feces. Use ADME to remember 4 principles of pharmacokinetics. Now, before we actually go further, there are different factors that affect drug absorption, drug distribution, metabolism, as well as elimination. So let's just try to look to describe briefly about the absorption, then we go to distribution, then we go to metabolism, and then we go to elimination. Okay, so this is a summary of what happens. Drug at the site of administration. This is the site of administration. Then it is absorbed. It goes into the plasma. Plasma, we know the plasma. Plasma is a fluid part of blood. After from the plasma, the drug can now be distributed in the tissues or cells, and then there it will, let's say maybe tissue like the organ like the liver, then this drug is going to undergo metabolism in the liver. Then these metabolites in the tissue, the metabolites, more like the end products, are going to be eliminated, okay, in urine, bowel, or feces under there. So this is a simple demonstration about how the pharmacokinetics occur: absorption, distribution, metabolism, then elimination. Okay, same with here. You get administer a dose, then it get to be absorbed, then it is in the plasma where there is protein binding. If it is free, meaning the protein have not bound to this drug, then it can actually be what? Be distributed. If it is distributed to the tissues or organs like the liver, then they are going to be biophase, whereby they are going to have to be, in case where here, to be transformed by the liver. So the elimination here is coming as a result of we have metabolism and excretion. So how is the drug going to be eliminated? We have liver metabolism, changing it to metabolites which can be excreted via mostly renally, the renal system. Then metabolism mostly occurs in the liver. Make sure that you know that the liver is the primary site for metabolism of a drug. Okay, so here on the distribution part is where a drug can go now into the cells and have its effect. You receive the therapeutic effect or the biological effect. Remember, we described the drug and the medicine. A drug is a broad term which anchors the word medicine in it, because biological effect is part of therapeutic effect is part of the biological effect. So there are some mechanism of absorption of a drug from the GIT. How does a drug move from the GIT into the blood plasma? Remember we said it needs to move from the GIT, from where it is being administered and to go into the blood plasma. Now, what are those mechanisms? Simple, we just apply physiology and move on. We have what we call passive diffusion. The drug moves from a region of higher concentration to that of a lower concentration. Passive diffusion does not involve a carrier, it's not saturable, and shows a low structure specificity. So passive diffusion is where the drug just moves from a region of higher concentration to a region of lower concentration. Then we have active transport, where this drug uses the energy-dependent active transport driven by hydrolysis of adenosine triphosphate. Then it moves inside. They are capable of moving against the concentration gradient. Okay, remember I said we are going to anchor this topic with what we call the physiology. Then endocytosis and exocytosis. Of course, endocytosis involves engulfing of a drug molecule by the cell's membrane and transport into the cell by pinching off the drug's filled vesicles. Okay. Then exocytosis, then for it just expels content, whereby the membrane cuts and then the content is getting to be expelled outside. The mechanism of endocytosis is the opposite of exocytosis. Facilitative diffusion, they can just actually use some large molecules. The carrier protein they're going to use in case of a drug size is big, they can use the carrier proteins to move from a region of higher concentration to a region of lower concentration and does not require energy. Okay, so that's it. And what are some of the factors that affect absorption? Remember, this drug, I know most of the time when we were children and we never knew about the pharmacology, we were wondering, how does a drug work? Where you have headache and then you take this medication and then it works. Isn't it not treated as food or what? Yes, it get to be absorbed, but where it goes, just like food, we eat and then we develop, meaning that it works. And then that's the biological effect. And that's how a medication works. Its effect is going to manifest as a therapeutic effect. You're going to be healed of that particular pain that you are suffering from. So what are factors that are affecting absorption? We have blood flow to the absorption site. The blood flow to the absorption site matters. So the blood flow to the small intestine is the higher as compared to blood flow to the stomach or large intestine. Therefore, blood absorption in the small intestine is higher as compared to any other region of the GIT. Total surface area available for absorption. So like the intestine contain what we call finger-like projections like microvilli, which provide the surface area for absorption, and like other sites. Contact time with the absorption surface. The contact time matters in such a way that let's say the absorption of a drug depends on how fast, on how the derailment time, whether it's going to stop for a longer period of time or it's going to move quickly. Okay, so when we look at contact time, in cases where someone has diarrhea or someone is constipated, in cases of diarrhea, the problem will happen is that the drug is going to be easily expelled out before it can even be be absorbed. Okay, and what happens same with the longer time or where it stays, let's say contact time in the GIT, where someone is constipated and then this drug is taking time for it to reach the small intestine. It's just in this maybe in the first part of the duodenum, first part of the small intestine, which is duodenum, instead of it going to area where there is a very total high surface area for absorption. So contact time, if it takes too long, is a problem. If it moves fast, is a problem. What example did I give? In case of a diarrhea, the drug is going to move quickly before it can even be absorbed. And in case of someone who is constipated, the drug is going to take time, maybe in the first part of the small intestine, duodenum, where absorption not really much occur, instead of it going to the jejunum. Okay, so you need to understand that. Then there's what we call some terms in pharmacokinetics, what we call bioavailability. What is bioavailability? Bioavailability just talks about how much of a drug you've given and how much of it is going to reach the system. Okay, what do I mean? If you give 500 milligrams of paracetamol to a patient, how much of it is going to reach the system? So if at all 250 of that paracetamol reaches the system, then we are going to say we are going to now divide. Okay, we are going now to divide. We are going to divide 250 divided by 500 multiplied by 100%. So it's going to give us around somewhere 50%. So bioavailability just look at how much of a dosage did you give and how much has it reached the systemic, the plasma. So in other words, let's define it. Bioavailability is the fraction of an administered drug that reaches the systemic pathology, systemic circulation. For example, if 100 milligram of a drug administered oral, you give this 100 milligram oral, and only 70 milligrams of this drug are absorbed and changed, meaning that it's the only which has reached the blood plasma. What are we going to do? We're going to do a simple fraction. And this simple fraction will just involve us to say that the bioavailability is going to be what has reached the system. What has reached the system is 70, and what did you give is 100 multiplied by 100 because it's a percentage. So 70 divided by 100 is going to give you 1, 2, which is 0.7. Okay, so this is 0.7. Now we are going to multiply it by 100. Remember, it says 100%. So that's when we manage to get what? 70%. So it's just about it. How much of this drug that you administered has reached the what? The system, the plasma. Okay. So that's it about it, bioavailability. So there are some factors that influences bioavailability. The drug that reaches the systemic, the drug that reaches the system is influenced by different factors. The first one is the first pass hepatic metabolism. What is first pass hepatic metabolism? First pass hepatic metabolism is the fact that there are drugs need to be to undergo metabolism by the liver before it can what? It can actually go into the system or the cells to work. Okay, they need to undergo metabolism for different reasons. One, when it is about to be excreted. Two, when it need to be converted into the active form of that drug. That's the active form. That's the only form that this drug can work. There are some drugs which are inactive form. Okay, so it going to the liver, it's going to undergo some changes, and these changes might reduce the amount of that particular drug that is going to reach the what? The system, the plasma. Then the second one of solubility of a drug. How does solubility of a drug affect bioavailability? So some drugs, um, those drugs which can easily be dissolved, okay? Those drugs which can easily be dissolved, they are more likely to be broken in a faster way and transformed by the liver, and only a fraction of it is going to reach the what? The system. But those drugs which are not easily dissolved, meaning that most of that drug is going to reach the what? The system. So we're just talking about how much of this drug is going to reach the blood system, which is the plasma. Okay, so if this drug was 500 milligrams, and only about 200 milligrams reaches the system, that is what we are talking about there. Then find the difference here. Divide 200 by 500 to find the bioavailability. So we're talking about solubility of a drug. What do we mean by solubility of a drug? Solubility of a drug, if a drug can easily dissolve, then it's going to be easily transformed by the liver, meaning a small amount of it is going to reach the system. But if it doesn't easily dissolve, it's not going to be completely transformed by the liver, and then most of it is going to reach the what? The system. Maybe only a proportion of it is going to be cut off. Chemical instability. There are some drugs which are easily affected by what we call the chemical in the body. So on the chemical instability, there's what we call in the stomach, there is hydrochloric acid. Okay. There are some drugs which are very unstable to hydrochloric acid. They can be easily broken by the hydrochloric acid, hence affecting the absorption. If it's the entire drug, and then for it to reach the absorption site, it would have been reduced by half. Okay. Then apart from that, it's also nature of a drug formulation. So the nature of drug formulation just talks about various ways in which and the pharmaceutical industries try to maybe make this drug. Okay. So there are some things, or there are some ingredients which are used and they can easily be broken, or they can support the drug. That's what about nature of drug formulation. Okay. Then we have what we call the distribution. Now the drug need to go into the interstitial and then to go into the cells of the tissue. Okay. So this drug now need to move from the bloodstream and go to the cells. What will affect it? What will affect it is one, blood flow. Okay. What is blood flow that we are talking about? The blood flow we are talking about is due to the fact that the rate of blood flow to the tissue capillary varies widely. Blood flow to the brain, liver, and kidney is greater than that to the skeletal muscles. Adipose tissue, skin, and viscera have still lower rates of blood flow. Remember, this drug is going to be distributed by blood. So if blood flow is less to areas like the muscles, adipose tissue, then drug distribution is going to be affected. Okay. Okay, so blood flow is going to be affected in that way. Then there's what we call capillary permeability. So capillary permeability is determined by capillary structure and by the chemical nature of the drug. So what do we mean by capillary permeability? There are different kind of capillaries that are there. So there's what we call, there are different capillaries of let's talk about the liver and the spleen. Okay. So there are what we call slit junctions between the endothelial cells, specifically the capillaries of the liver and the spleen. They are fenestrated capillaries and drug can easily cross. But let's talk about the brain, where the capillaries are continuous and there are no slit junctions. So the blood to the brain is going to be what? To be the blood distribution to the brain is going to be what? Affected. Okay, liver and spleen, they have basement membrane which is exposed due to large discontinuous capillaries which are fenestrated. Okay, and like the continuous capillaries which are in the brain, which is going to affect the distribution of this particular drug. Okay, so like here, this is an example whereby this is a liver, and then we have what we call the slit junctions, and drug can easily move. But in case of that of the brain, as you can see, this is just a continuous membrane, and blood and drug distribution is going to be affected because it's continuous like that. Okay, so this is continuous like this, and drug, they are going to find issues unless there's a particular characteristic of that particular drug which you can describe. Okay. Then also drug binding. What about drug binding? Remember I said it's an overview. So drug binding is due to the fact that some drugs binds to what we call proteins in the blood plasma, like albumin, etc. So drug binding, there are some drugs which have a high binding ability. They bound to these albumin, and then for as long as the drug is not a free protein bound, then it's not going anywhere. Only a free drug is going to be distributed. Okay. So in case where we have this drug which is high protein bound, then most likely that particular drug is not going to be evenly distributed. Okay. So we have protein binding as well as tissue binding. Hydrophobicity. So the chemical nature of a drug strongly influences the ability to cross the cell membrane. Okay. So like hydrophobic drugs, like the way we said, we're looking at the surface of the cell membrane and what substance it crosses it. The hydrophobic drugs readily move across the most biological membranes. But the problem is with the hydrophilic drugs, they cannot easily penetrate cell membrane. Okay, so you should review the physiology. Physiology and pharmacology work hand in hand. Okay. So he said hydrophobic drugs, they are those drugs which are water hating. Okay, and they easily move across the plasma barrier. Unlike hydrophilic, they do not easily penetrate cell membrane and must pass through the exit junctions. And then volume of distribution is just about it's a volume of distribution be thought of an fluid volume that is required to contain the entire drug in the body at the same concentration measured in the plasma. So volume of distribution, we're looking at how much of the drug is in the plasma and how much of the drug is in the has been distributed. Remember, the intended function or the intended area is not the plasma. The intended area is the intended area is the for it to be distributed to the tissues, to the cells, so that it can function or produce its effect. But when a lot of drug remains in the plasma, okay, then it's going to affect its distribution. Okay, so that was about the distribution of drug and how it's going to be affected. So now we are going to end on this side, and I'm going to make part 2 of introduction to pharmacology. So we're looking about now drug clearance. How about drug clearance? Drug clearance is about how a drug moves out of the body. Once a drug enters the body, the process of elimination begins. There are three major routes involved. We have what we call hepatic metabolism, elimination in the bowel, elimination is urine. Okay, so hepatic metabolism is where a drug now need to be transformed, elimination in the bowel, and then elimination in the urine. So most drugs are eliminated according to first order kinetics, and although some, such as aspirin in high doses, are eliminated according to zero order or non-linear kinetics. We are going to explain what first order kinetics is, and we're going to explain what the zero order kinetics is. Today we're going to end on